I'm here with Epidemiologist Bonny Specker, who is going to give us an update on the COVID-19 situation in our region, in our state, across the world, and across the nation. Bonny, what do you have for us today?
Thanks, Chelsea. Before we get to the weekly update, there are just a few things that I thought would be good to share. One of them is the whole issue of who qualifies for that third vaccine. There's a lot in the news lately and it's been a little bit confusing, so I thought I would just highlight that and provide some links. And then there's a survey on U.S. vaccinations that I thought was interesting, and then some projections for the state of South Dakota and what people are thinking it's going to look like this fall. And then also some Brookings County mortality data comparisons that I thought would be good to update people on. As far as who qualifies for the COVID booster, the CDC is recommending this just for the Kaiser booster right now. And if you had completed the Kaiser series, and it's been 6 months since you've done that, and you're 65 years and older or a resident in long-term care settings, you would qualify. If you're between 50 and 64 and you have underlying medical conditions, that you're qualified to get that third shot. And then also, if you're between 18 and 49 with these underlying medical conditions, they're saying it really depends on your individual benefits and risks. So that's something you might want to talk to your healthcare provider about. And same with people who have occupational exposure, healthcare providers, teachers. If you're between that age of 18 and 64, you might want to talk to your healthcare provider about whether or not you should be getting that booster. One of the things I want to note are these underlying medical conditions, and they can be found at this website down here. Overweight and obesity are actually listed as one of the medical conditions that puts someone at high risk for COVID. And this is going to allow 71% of South Dakota's population to qualify. In the state of South Dakota, there are 7 out of 10 people who are either overweight or obese. So they are in the high risk category. There are also some things out there about the Moderna and Johnson & Johnson vaccine. Those are already approved, the boosters, for people that are immunocompromised. The people that aren't immunocompromised, these people that are up in here, based on age, whatever, it's thought that there's going to be some decision made about the boosters for Moderna and Johnson & Johnson for people that aren't immunocompromised in the next couple of weeks. So that should be coming out in the news, and maybe the next time we do this, if something's out, we can let people know. But it's likely that boosters will be following, recommendations for both Moderna and Johnson & Johnson. As far as this survey, I thought this was really interesting. This is coming out of the Kaiser Family Foundation. They do a lot of surveys. The website for the full thing is down here. But this is what's happened over time. And if you can see that this darker line, this is the most recent, September of 2021, 72% of the people have already gotten the vaccine. There's a small percent that say they're going to get it as soon as possible. And this has, been steadily getting smaller, that percentage over time, as is the percent of people who said that they were going to wait and see. Back in last year, it was 20%. That percentage is down to 7%. Then there's a group that saying that it's only going to be only if it's required will they get it, and that has dropped too. Back here in 2020, it was 9%, and it's about 3 or 4% right now. Then there's this group, which I think is an interesting group. It has not changed a lot, this percentage. So I think it's people that have firm beliefs about vaccines that you're not going to change their mind. And it runs between 12 and 15%, and these are people that are saying they're definitely not going to get the vaccine. But fortunately, they're a minority, and the majority of people will be, getting the vaccine, or, looks like they'll be getting the vaccine in the near future. And the numbers here, I think, are looking pretty good. Now, South Dakota isn't quite this close as the national data. We're running a little bit lower on the people who have already gotten it. Hopefully we can get those numbers up so that this can be over, because I think everyone would like it to be over, or at least at a low baseline level, which it's not. So I thought I'd just show some of the predictions. This is from 2 days ago. On September 28th, I downloaded these. And this is the curves these are the estimated numbers of infections by day since the beginning of this outbreak. You can see this peak last November. Then we had one early this spring, and this is where we are right now. It is plateauing or looking like it's dropping a little bit. But the projection is that it's going to come back up. And this projection is based on the increase that you typically see in the fall for these types of viruses. And this red line is the worst case scenario, which I think right now, given the non-pharmaceutical interventions, things like mask wearing, socially distancing, that's not happening. So I wouldn't be surprised if South Dakota follows more the worst case scenario than the projected. But either way, we are seeing an increase. If we go with the worst case scenario, the peak is expected around December 8th for the number of cases. And you can see what effect this something like mask wearing has on what this curve looks like, as far as reducing the spread. This website also gives you social distancing as one of the things that you can alter. So if you're interested in that, it's worth looking at. And so how does that translate to hospital resources? This is what's going to be required in terms of hospital beds under current projection scenario, not the worst case scenario. So this is if what they're saying they think is going to happen happens, we're going to see quite a large increase in the number of hospital beds that are needed. And actually, the number of ICU beds that will be needed by January is going to be greater than what it was last November. So these projections, I think, are a little worrisome. It would be nice if they're wrong, but they have done a pretty good job. This is coming out of the University of Washington. They've done a pretty good job making these predictions previously. And here we have the number of deaths, and this is if there was masking and other non-pharmaceutical interventions. And then what if they're projecting, just that normal projection, this is the worst case scenario. So the current projections, we're going to end up with close to 2,400 COVID deaths. We're at around 21 something right now. So a couple hundred more deaths in South Dakota. If it's worst case scenario, it's going to be about 100 more deaths than the projected. So when we're talking about deaths, I thought this was interesting. This came off of the Vital Records website for the Department of Health. These are Brookings County data, and these are the average number of deaths per year between 2015 and 2019. So usually in an average year, we have 48 deaths due to heart disease, 40 due to cancer, so forth. If you look at the observed COVID deaths in 2020, there were 30 of them from Brookings County. So you can see that how it compares to other deaths and the numbers that are normally experienced. And I thought this was an important table because, 37 doesn't sound like a very big number now because we're all used to hearing, these large impacts from this particular virus. But I thought it would be interesting to compare it to what we normally see in Brookings County. So we are, in 2020, probably COVID was the third leading cause of death among residents in Brookings County, more than what you see in stroke, respiratory disease, Alzheimer's, injuries and accidents, blood pressure, chronic liver disease and cirrhosis. And so far this year, we've had 7, but again, this is incomplete because we're still in 2021. But I thought this was an interesting table. Now, as far as the weekly summary, again, these data are from yesterday, Wednesday, September 29th. And this is the Brookings slide, and we did drop, so that's a good sign. But as you remember with those projections, if we are following that dip that they're seeing in South Dakota, it'll be interesting to see if these come back up as the University of Washington projected, whether Brookings follows that or not. Last week we had 81 new cases. The week before we had 130. 37% of those cases last week were less than 20 years of age. 34% were between 20 and 39. 20% between 40 and 59, and 9% in that 60-year and older group. So it's again, just as it's been since school started, pretty much, the new cases are being seen in those school-age children and the young adults. And we still are in a high level of spread. If you look at the hospitalizations for Brookings County, last week there were 4 of them, and the week before there were 2, so we're still running pretty high on hospitalizations. We really haven't seen higher numbers except during that peak last November. If you look at the state, we're seeing this flattening out, a very small decrease as of yesterday. And again, whether this is going to come back up or continue down, we'll have to wait and see. About 2,800 new cases both this past week and the week before. At the state level, the age distribution of the cases are pretty consistent across these different age groups, whereas in Brookings, they were more in those 2 younger age groups. Statewide, it's really more evenly spread out. Here we have hospitalizations statewide, 134 new admissions last week compared to 144 the week before. And there are fewer people hospitalized, 205 as of yesterday, with 57 of them in the ICU, and compared to 226 with 65 in the ICU from the week before. And even though this has been fairly steady, we can talk a little bit soon about this difference in the census. This census, just to remind people, also includes out-of-state patients. The total hospital admissions are in-state residents only, but the actual numbers in the hospital include out-of-state people as well. The age distribution of those hospitalizations, 4% of them were pediatric cases. Actually, all of these that were less than 20 were less than 10. So they're very young kids that are being hospitalized here. 21% in that 20 to 39 year age group, 25% in the 40 to 59, and then about 50% in the 60 plus. So it's still really affecting those older people, but also this is different than last year with more younger people being hospitalized. As far as deaths, we had quite a few deaths last week. There were 24 of them statewide that are put on the dashboard. compared to 16 the week before. So you can see this increase. And this is a lagging indicator. So that peak in cases that we saw this past month is being now reflected, almost a month later with increasing numbers of deaths. One of those deaths was in a 20 to 39-year-old. 10 of them, this is I think a fairly large number, were in the 40 to 59-year age group, and 13 of them were in the 60 years and plus. Again, this particular Delta virus is affecting these younger ages, both in number of cases, hospitalizations, and deaths. If you look at the US data, we're doing pretty good. It's dropping pretty significantly, but still it's quite high. There were 800,000 new cases last week compared to close to 1 million the week before. If you look at the deaths, that's pretty steady, around 14,000 deaths per week. If you look globally, we've had 3.2 million cases last week compared to close to 3.7 million the week before. So this is also dropping, but still quite high. And as far as deaths, this has dropped about 56,000 deaths last week compared to 60,000 the week before. These are more than the town of Brookings, but it's just, I find it really hard to comprehend those large numbers, and I'm sure other people do as well. And instead of giving the usual ending on what to do, I think we've said that 100 times at least, and people know what they're supposed to be doing. But I do think it is important to realize that the healthcare workers are really stressed right now, and anything we can do to thank them would be great. They do deserve it. So that's how I'll end today.
I agree. Big shout out to the healthcare workers for everything that they're doing. I know it's long hours, and sometimes it's not always probably easy to see all the things that they see, and just tiredness kicks in, and just that with the healthcare workers, they're in the front lines of it, and they've just been so selfless and so wonderful at all of this. So thank you so much for everything that you do. Have a great week.